At Access Bank, we have a commitment to sustainability, which is to inspire lives now and in the future. And part of our commitment is also to ensure that we keep these children in schools to encourage education. And this simple project also is helping us tackle climate action, because we are collecting raw materials from the environment, which is waste, tire waste, upcycle them into school sandals, deprived schools, public school children, and if it's a special needs school, it's an advantage. Another important aspect of this project is that it's also supporting job creation. We're supporting 500 shoemakers in the Ashanti region, local shoemakers in the Ashanti region. And also importantly to know that while we are supporting education, supporting environment, we're also impacting entrepreneurship in Ghana.
Access, more than banking.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support.
I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman. I am a W woman.
Welcome to the launch of the second phase of A Sandal More for a Better Tomorrow initiative by Access Bank Ghana PLC. My name is Portia Gabo and I'm humbled to be your MC for today's event.
We are grateful to Access Bank for this opportunity. The sandals they will be given, they won't just be giving them smiles on their faces, but warmth on their feet.
It is with great pride and deep sense of purpose that we gather here today to launch phase 2 of our groundbreaking initiative, A Sandal More for a Better Tomorrow. This project is not just a testament of our unwavering commitment to sustainability and community impact, but also a significant way to give back to the communities we operate as we celebrate Access Bank's 15th anniversary. As part of our mission to advance Africa, we pledge to provide free school sandals to 1 million deprived children across Ghana, ensuring that they have the support needed to stay in school and pursue their education.
On behalf of the Ghana Education Service, I extend my heartfelt gratitude to Access Bank for their generous support and to everyone involved in making this event a reality.
On behalf of the Ministry of Lands and Natural Resources, I extend a great gratitude to the Managing Director of Access Bank, Mr. Elumide Olatunji, and all the staff of Access Bank for their visionary leadership and unwavering support.
I would like to close by thanking Access Bank for initiating this effort and inspiring us all to put hand in hand with them on this positive journey, a journey whose story continues to be written moving forward. Let us keep working together as partner and as a community, and to gather more and more people to join this wonderful effort and to create lasting positive change as we give these children the foundation for a better tomorrow.
At Horseman Shoes, we make footwear for places going people. And we believe that through this A Sandal More for a Better Tomorrow initiative, Access Bank is definitely going places. We want to take a moment to also appreciate Rana Motors for supporting and aggregating the used tires to us so that we can work through our shoemakers And we are committed that these sandals will be comfortable, they will be durable, and they will be delivered in their full quantity on time.
Well, it's now time for us to unveil the Better Tomorrow track by Rana Motors. This track will travel across all the 16 regions of Ghana, not only delivering sandals, but ensuring that the hopes, dreams, and aspirations of children in deprived communities come alive.
Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't.
This one is everlasting. You hand over to your younger brother, and they hand over to your grandchildren, and it goes on forever.
At Access Bank, we have a commitment to sustainability, which is to inspire lives now and in the future. And part of our commitment is also to ensure that we keep these children in schools to encourage education. And this simple project also is helping us tackle climate action, because we are collecting raw materials from the environment, which is waste, tire waste, upcycle them into school sandals, these deprived schools, public school children, and if it's a special needs school, it's an advantage. Another important aspect of this project is that it's also supporting job creation. We're supporting 500 shoemakers in the Ashanti region, local shoemakers in the Ashanti region. And also importantly to know that while we are supporting education, supporting environment, we're also impacting entrepreneurship in Ghana.
Access, more than banking.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support. I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman. I am a W woman.
Welcome to the launch of the second phase of a Sandal More for a Better Tomorrow initiative by Access Bank Ghana PLC. My name is Portia Gabo, and I'm humbled to be your MC for today's event.
We are grateful to Access Bank for this opportunity. The sandals they will be given, they won't just be giving them smiles on their faces, but warmth on their feet.
It is with great pride and deep sense of purpose that we gather here today to launch phase 2 of our groundbreaking initiative, a Sandal More for a Better Tomorrow. This project is not just a testament of our unwavering commitment to sustainability and community impact, but also a significant way to give back to the communities we operate as we celebrate Access Bank's 15th anniversary. As part of our mission to advance Africa, we pledge to provide free school sandals to 1 million deprived children across Ghana, ensuring that they have the support needed to stay in school and pursue their education.
On behalf of the Ghana Education Service, I extend my heartfelt gratitude to Access Bank for their generous support, and to everyone involved in making this event a reality.
On behalf of the Ministry of Lands and Natural Resources, I extend a great gratitude to the Managing Director of Access Bank, Mr. Elumide Olatunji, and all the staff of Access Bank for their visionary leadership and unwavering support.
I would like to close by thanking Access Bank for initiating this effort and inspiring us all to put hand in hand with them on this positive journey, a journey whose story continues to be written moving forward. Let us keep working together as partner and as a community, and to gather more and more people to join this wonderful effort and to create lasting positive change as we give these children the foundation for a better tomorrow.
At Horseman Shoes, we make footwear for places going people. And we believe that through this A Sundown More for a Better Tomorrow initiative, Access Bank is definitely going places. We want to take a moment to also appreciate Rana Motors for supporting and aggregating the used tires to us so that we can work through our shoemakers. And we are committed that these sandals will be comfortable, they will be durable, and they will be delivered in their full quantity on time.
Well, it's now time for us to unveil the Better Tomorrow track by Rana Motors. This track will travel across all the 16 regions of Ghana, not only delivering sandals, but ensuring that the hopes, dreams, and aspirations of children in deprived communities come alive.
Reach for the sky. Get up, don't let nothing hold you. Get up right now, right now. Get up, don't let nobody tell you that you can't.
This one is everlasting. You hand over to your younger brother, and they hand over to your grandchildren, and it goes on forever.
At Access Bank, we have a commitment to sustainability, which is to inspire lives now and in the future. And part of our commitment is also to ensure that we keep the children in schools to encourage education. And this simple project also is helping us tackle climate action, because we are collecting raw materials from the environment, which is waste, tire waste, upcycle them into school sandals, deprived schools, public school children, and if it's a special needs school, it's an advantage. Another important aspect of this project is that it's also supporting job creation. We're supporting 500 shoemakers in the Ashanti region, local shoemakers in the Ashanti region. And also importantly to know that while we are supporting education, supporting environment, we're also impacting entrepreneurship in Ghana.
Access, more than banking.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support. I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman. I am a W woman.
You're welcome to the launch of the second phase of a Sandal More for a Better Tomorrow initiative by Access Bank Ghana PLC. My name is Portia Gabo, and I'm humbled to be your MC for today's event.
We are grateful to Access Bank for this opportunity. The sandals they will be given, they won't just be giving them smiles on their faces, but warmth on their feet.
It is with great pride and deep sense of purpose that we gather here today to launch phase 2 of our groundbreaking initiative, a Sandal More for a Better Tomorrow. This project is not just a testament of our unwavering commitment to sustainability and community impact, but also a significant way to give back to the communities we operate as we celebrate Access Bank's 15th anniversary. As part of our mission to advance Africa, we pledge to provide free school sandals to one.
It's going to be informative, and I hope all my colleagues will join in and share the link with their friends as well. Before we delve into the main conversation, I would like the Women Banking team to give a brief introduction or a brief presentation on our W Banking. Jemima, I would like you to come in. We could always use our reactions as well to show interest. Thank you.
Thank you, Gibsy. Hello, everyone. Good evening to all of you. So my name is Jemima, and I work with the Women Banking Units of Access Bank. I'm sure that when we talk about women empowerment, everyone knows that Access Bank stands out. We are very, very committed to women empowerment. We are passionate about the growth of women. We really want to take you through the journey of how it all started and what really we are about. So in 2006, our parent company in Nigeria launched the Gender Empowerment Program, GEM. But this was targeted at only women in businesses. But through research, we discovered that there were other segments of women with unique needs that needed to be catered for. And so we birthed the W initiative, which is a more holistic approach to banking and supporting women. Now, W simply stands for woman, and it's simply the home of everything that Access Bank has to offer women or women generally. And I'm very proud to say that not only are we present in Ghana and Nigeria, but we are also in 11 other African countries. Now, what is our mission? What do we seek to achieve? At W, our mission is simple. We want to inspire, we want to connect, and we want to empower every woman. But to be able to do this, we had to segment women into groups, what we refer to as our focus segments. And so we have W in business, and this refers to women enterprises. Either you own all the shares in the business, or you own about 50% shares, or you manage the business and you are looking forward to growing or expanding your business and unique solutions. Another segment is the W professional or professionals. And here we are looking at women who are career-oriented, women who are very determined to grow professionally, to climb up the corporate ladder. And then we have W and family. These are women who are family-oriented. Not only do they care about themselves, but they care about the needs of all their family members. Of course, we can't talk about segments and leave our Gen Zs. I'm sure we have a lot of them in the house. We have unique products for them because they come with their unique needs as well. Finally, we have the W quintessential. These are women who are achievers, women achievers. They've gotten to the peak and they're looking at impacting the next generation. They want to leave a legacy. by impacting the next generation. So this is basically the focus segment that we look at. Now, one would ask, what is an it for us as a woman? Why should I be concerned about W? Why should I be a part of it? Now, we are a bank and we are mandated to provide financial solutions to our customers and prospects. Now, our value propositions are hinged on 4 main pillars. And because we're a bank, our first pillar is access to finance. We understand that our financial needs are unique. And so we have affordable, tailored, and specialized financing to support all our women's segments. And whether you're a woman in business who needs an account that is no COT, we have a W Power loan, W Power Empower business accounts. And if you want discounted loans, we have our bridge in a break, which comes at 7% single digits, which is the best on the market. But this is for players in the agri sector. If you are a woman in business and you're not in that sector, you can also benefit from other discounted loans that we have, like our instant business loan. And if you're a woman professional, we have our Empower Salary account that comes with its added lifestyle values and other products like our Pick Now, Pay Later. Now, we understand that as women, emergency do happen. You sometimes do not plan to have any health challenges, but it sometimes happens. When it happens, what do? Do you take the last money that you reserved for an important project? We are saying that don't stress yourself. We have the W Health loan. You can come to Access Bank. We support you with a loan that would address your health needs. So this basically sums up our access to finance pillar. Another pillar that we look at is access to capacity building. And here we are basically providing support to equip women with the skills that they need to thrive in their business, to grow professionally. So we have business advisory services that we give to women enterprises. We have SME clinics. We have financial literacy seminars for our professionals. We do conduct professional symposiums and career development programs. And for those who are all about motherhood, we also have our annual mom-to-mom chats. We have seminars on parenting, on motherhood, on balancing work and family. Now, we know that when we talk about development for women, you cannot leave out networking. Networking is a very important pillar to us. As I mentioned early on, we have a community of women achievers who are looking at impacting the next generation. So through our mentoring and coaching programs, we pair these women who are aspiring to get to the top, to our women achievers, so that they can network and learn from these women. And if you're part of our community, we do have some lifestyle and networking events that's exclusive to our community members. Last but not least, we have the access to markets. And this is of benefit to women enterprises, that particular segment. So we hold SME fairs, we connect them to buyers so that they can have access to buyers to grow their businesses. We have B2B programs that we do to connect women in our books to suppliers, not only in Ghana, but also beyond Ghana. And we form strategic partnerships that would also help to get more women enterprises to connect with other buyers. Now we have some good news for you. The good news is that our online interactive platform is now up and running. So we want to encourage every woman on the call to join this empowering community. We also have our social media handles. We are very active there. So if you haven't followed us yet, please follow us at W Community GH. I will drop the link to our community in the chat session so that you can all be a part of it. And we don't want you to keep this good news to yourself. If you're a woman on the call, we believe that you have other women in your circle. So please talk to them about the W initiative and ask them to join the community. If you're a man, we believe that you also have women in your circle as well. It could be your mom, your auntie, your cousin, your colleague, your friend, your wife, or even your girlfriend. Please ask them to join this community so that together we can all get inspired, connected, and empowered. Thank you very much for your time. Getty, please, over to you.
Thank you very much, Jemima. And thank you to the W Banking team for rolling out programs to empower women across Ghana. Now let's delve into the business of the day. Our resource person is Mary Agama. She's a physician assistant with a master's in public health. She's an advocate, a strong advocate for breast and cervical cancer, and she's currently the head of Department of Cervical and Public Health Unit of the Presby Medical Center. Please help me invite our resource person with virtual claps.
Hi, everyone.
Welcome, Mary.
Good
Hi, Mary.
evening. Good evening, and thank you so much for such a very unreal welcome note. Okay, as you rightly said, my name is Mary Agama, a physician assistant and also a public health practitioner. All right, so it's already late, and I know everyone is tired and busy, so we can just delve straight into the order of today. Moderator, please. I want to, through you, apologize in advance for some very graphic images that we will be showing this evening. And again, we'll be talking a lot about sex, penis, and vaginas. So please, I want to apologize in advance to very sensitive audiences. Thank you.
Thank you.
All right, so now we can start. So why are we here today? We are just here mainly to speak about safe sexual practices, and sexually transmitted diseases, or also known as the sexually transmitted infections. So these terms are used interchangeably, all right? So what are some things that we have heard about sexually transmitted infections? And are these true? Some of them include, is it true that using of condoms protects 100% against STDs or STIs? Is it also true that having oral sex or anal sex prevents an individual from having STDs or STIs? Is it also true that all STDs present with symptoms? Is it also true that it's only people who have multiple sexual partners who are at risk of having STDs or STIs? As we go on, we'll get answers to that, and hopefully by the end of this presentation, we will be able to address these. Thank you. All right, so what are STDs or STIs? So STDs or STIs are mainly infections which are passed on from one person to another through sexual intercourse. The sexual intercourse here is not only limited to penile vaginal sex. It also involves oral sex and anal sex. That's very important to note. It's also, STDs can also be transmitted from mothers to their babies through what we call vertical transmission. So mothers who have STDs during pregnancy can transfer the STDs to their babies and during breastfeeding as well. STDs can also be transmitted from one person to another through blood transfusions. So either you are sick, you go to the hospital, which is rare, but can also happen. So you go, they're supposed to give you blood, and then they give you a blood which is infected with an STD, which is usually rare because there are a lot of procedures and processes they take to make the blood safe for use. And again, it's also transmitted through sharing of sharp objects as well. So why are we even talking about this in the first place? So why is this even a problem? So worldwide, we have seen that over a study done in 2016 revealed that 1 million people are diagnosed of STDs or STIs every day. This is not every week or every month. This is every day. And then a study done in 2021 in Ghana showed that about 3.4%, which is roughly about 4 out of 100 people in Ghana are diagnosed of STDs or STIs. And these are the people who are coming with symptoms or signs. So it means that these numbers can even be more, because as we are going, we'll get to know that it's not all STDs that will show signs and symptoms. All right, so what are the causes of STDs? So these STDs that we are talking about, what are the causes? So they can either be caused by bacteria, it can be caused by viruses or parasites. So bacterial causes of STDs include gonorrhea, syphilis. The common ones we know are gonorrhea, syphilis. And then we can also have the likes of chancroid, chlamydia, vaginitis. The viral ones, we can have HPV, which we are talking about a lot this month, and we are talking about HIV, which is causing AIDS, and then this HPV also causing genital warts and oropharyngeal cancers. As we go on, we'll be able to delve more into some of these ones. And then parasites causing trichomoniasis vaginitis. All right. Okay. So what are some of the signs and symptoms that when you have an STD or an STI, you would exhibit? When the person is coming to you and telling you like, okay, no, this one day, what I'm experiencing is an STD or it's an STI. So you can either have an abnormal vaginal discharge or penile discharge. And again, you can also have frequent urination, which means that you are urinating at very frequent intervals and at short intervals. So every few minutes, you have the urge to go and urinate. And again, you are urinating fast and then it's scanty. It's not because when you go to urinate, you are getting a lot of urine. You are getting it small, it's coming small. And then sometimes there's also the urge that, okay, by or all haven't finished urinating. We call it sensation of incomplete bladder emptying, or yes. So you want to squeeze to let the rest come out. And then painful urination. All these things can be a sign of an STI. Also, you can also notice a sore or a rash around your genitalia. And then there's also an abnormal vaginal odor. You can also experience anal itching or vaginal itching, and then abnormal vaginal bleeding. All these things, low abdominal pains, fevers, these are all symptoms of sexually transmitted infections. What are some risk factors? Well, risk factors generally don't mean that these things in place or when you do all these things, you will get an STI or guaranteed to get an STI. These are just things that put you more at risk or increase your chances of having an STI. So like having multiple sexual partners, that's what we all know. Having multiple sexual partners will increase your chances of having STIs. And then you realize that there is cigarette smoking. What's cigarette smoking? And then the oral contraceptives you can see there. Prolonged use of oral contraceptives will predispose you to having certain infections such as cervical cancer because of the prolonged exposure to estrogen. And then the nicotine, or again, in the cigarette would increase your chances of having conditions such as cervical cancer. Again, vaginal douching. This place, it's a topic we don't want to talk about, but sadly, we have to talk about. In recent times, we've been having a lot of vaginal douchings. Women are being very adventurous with introducing foreign materials into their vaginas because either they want their vaginas to be sweet, they want their vaginas to be very tight, so they have all these sweetness and things they have to use. Some are these herbal things that they said, oh, some people say, no, I've been seeing this discharge, or after my menses, I see this odor, so I want to introduce this herbal things or whatever it is so that I can feel tight and clean. So my boss once said that a patient came to him with what the person uses is bleach and omo, Parazone and Akesha, to wash themselves because they didn't feel like they felt like they had sex with somebody that they thought had an STI. So all these things are not important. As we go on, you'll get to know because they increase your chances of having infections. All these things, let me just talk about it now. All these things have they are harsh chemicals. And so when you are introduced into your vagina, they cause tears, micro tears that you might not even see. And sometimes too, they will stimulate the body to fight. The body will see it as a foreign body, and so their body's natural reaction to it is to fight it. And so that process would start an inflammatory process, which means that blood vessels are now being exposed, and it means that you have higher chances of progression of an STI if it exists. And then for women who have multiple children, who have had multiple children, who have had like 4 or 5, you have increased chances of having infections such as cervical cancer. This is because of prolonged exposure to estrogen. Again, the tests, the small tests that occur during delivery, all these things can predispose you to getting infections such as cervical cancer and STDs, or progress your STDs if the organism is present. So what other risk factors exist? Early coitus. So research has found that women who have sex who started having sex at a very tender age, they are at high risk of having cervical cancer. This is because of so in cervical cancer, as we go on, we'll talk about them. We will talk about it. But in cervical cancer, you have to have at least a minimum of 10 years for the disease to progress. And it's caused by the HPV virus. So this HPV virus doesn't have to just be a HPV virus that is coming and going. It has to be persistent because naturally the body will try to fight or clear the HPV infection. Like every infection that your body will get, your body will naturally, your body's first response to it is trying to clear that infection as fast as possible. So naturally, your body will try to clear all that HPV. But when it's unable to, that is what we call persistent HPV. And that is what causes the cervical cancer. So in women who have sex at a very tender age, they now have a longer period of time to manifest the whole sexual the cervical cancer. I don't know if it's clear, but if you have sex at a young age, so if a young lady started having sex at a young age of 12 years, this lady, if she has persistent HPV infection, this infection can persist, give her about 10 or 15 years, which is like this lady is coming to 25 or 35. Or 25, yes, 25 or 22 years, she can start having signs and symptoms of cervical cancer, which we don't want to get there. I don't know if I made a lot of sense there. All right. So another thing is immunosuppression. So conditions that causes your immunity to be lowered, like patients with HIV/AIDS, patients with TB, patients with diabetes, they have naturally lowered immunity. And this naturally lowered immunity causes HPV to persist. Infections such as HPV and other STDs to persist and result in other dire consequences that we do not want to experience. So now we are going to take the STDs one after the other, mainly the common ones, and we'll talk about them. So syphilis. So syphilis, it's caused by Treponema pallidum. It's a bacteria. Syphilis is curable. It means that when you have syphilis, we can treat you. Treatment exists for syphilis. And so how does syphilis come? How is it? It is primarily through, you get it through sexual intercourse. And I stated earlier that it could be penile vaginal sex, it could be oral sex, or it could be anal sex. So there are stages in which this syphilis will progress. So in the first stage, which is the first encounter, you would realize that you will notice a rash, which we call a chancre. Okay, it's a tiny rash which appears at the sites of sexual intercourse. So if it is penile vaginal, you expect that the rash or the ulcer would appear at the penis or the vagina. If it's the anus, you'd expect the same thing. But the good thing for males is that you can easily see it if it appears. But for females, because of the position of the vagina, you might not see it. And this chancre I'm talking about, it's short-lived. So within 3 to 5 days or even 7 days, it can clear away. And then you can go into secondary syphilis. During this period, I must say that during the primary stage or in the secondary stage, which is the first stage and second stages, you can transmit infection. So because of the presence of the rashes or the sores, you can transmit the syphilis infection. There is also the latent phase. In the latent phase, the bacteria just remains hidden and the affected person does not experience any symptoms or any signs, and the person cannot even transmit the bacteria at all. And again, we move to the tertiary stage. In the tertiary stage, this is where syphilis has persisted and has been left untreated for so long, and now it has spread to other parts of the body. So this is not to say that all syphilis that are left untreated will result into tertiary syphilis. No. There are people, researcher even says that just a third of people who have untreated syphilis would finally get to tertiary syphilis. All right. And this will take about 15 years for you to get there. So it means that it can remain latent there for a very long time. So the next slide after this one will show you the chancre I was talking about. So the chancre is the round ulcer that you can see at the penile head of the glans penis or the glans penis. So that's what we can see there. And then in secondary syphilis is the one you see on your right, which is the disseminated rash all over. Usually this rash, the secondary syphilis, the rash is painless, except of course it is superimposed by another type of infection. That's when it becomes painful. But otherwise, it's a painless kind of rash. So now we move to the next STI, which is gonorrhea. Gonorrhea, we have all heard of and maybe experienced at a point in our lives. And maybe knowingly or unknowingly. And then, so gonorrhea is preventable. It is curable, just like syphilis. It is also curable. And then, so you don't have to keep it or be shy about it. It is caused by Neisseria gonorrhoeae, and it is also transmitted through vaginal sex, anal sex, oral sex. All right. So primarily, when you have gonorrhea, the classic symptom that everybody would like majority of people, let me not say everybody, but majority of people would experience is the discharge. So depending on where the sex happened, which is either oral, vaginal, or penile, you'd have a discharge. So you can either have a vaginal discharge, you can have a penile discharge, or anal discharge. Okay, those are the primary things that you can see in gonorrhea. But you can also have other symptoms, like in men, you can have this discharge can be whitish or greenish, but it's very thick. It's like phlegms. So they'll describe it as phlegmy, or yes, basically phlegmy, very thick. We call it purulent discharges. Okay, and then they can also complain of pain or burns when they are urinating. So they'll tell you inside their penis. The men will tell you inside, they feel some burns inside their penis or some itching inside their penis, or they have a painful scrotum, testis. Their testis is either painful or is swollen. In women, most of the times, women with gonorrhea, they do not show symptoms, or they don't even know at all that they have this condition. In rare cases, the few that will show symptoms would have purulent vaginal discharges. These are for women who are very attentive to their bodies and they know their bodies. So the least changes they see in their bodies, they know. So they can have the discharge, or they can have the dysuria, which is the painful urination. Or when they're having sex with their partners, they will tell you that I am having pain when I'm having sex with my partner, which was initially not there. So the anal symptoms include the discharge from the anus, the purulent discharge coming from the anus, or bleeding from the anus, or there's this itchiness that they are seeing, they are feeling around their anus, or there's a sore they are feeling around, or they are unable to move their bowels at all, or when they are moving their bowels, they are having pain. All right, so the next thing that we'll talk about is hepatitis B. So hepatitis B is caused by a virus, and then hepatitis basically is the inflammation of the liver. So hepatitis B affects the liver. So in hepatitis B, we have the three viruses mainly associated with the hepatitis are hepatitis A, B, and C. Hepatitis B is passed through sexual contact or exchange of body fluids. Okay, and then it is preventable. It is not curable. It can be managed but not cured, but it is preventable, which means that there are vaccines available for hepatitis B. So for women, for people, women, male, everybody, and even now it's part of our EPI. So the children who are born now, it's part of their immunization schedule. So they are being vaccinated. But for those of us who were not opportune to be in this category where we had the hepatitis B vaccination at birth, you can take the vaccine, but first you'd have to test first. And then when you are negative for hepatitis B, that is when you take the vaccine. So what are the signs? So hepatitis B is asymptomatic. So you can have hepatitis B and you not show any signs and any symptoms unless the liver is in trouble or it has progressed. So then in that case, you begin to have symptoms like fever, vomiting, nausea, fatigue, jaundice, which is the yellowing of the eyes, or they tell you that you are passing stool and it's gray, which is like yellow or bentonite clay, or they are passing dark urine, okay, or color-like urine, or their urine is beginning to look like coke. Then these are signs that, okay, this person might be having a liver condition, which may be associated with hepatitis B. So now to the main reason why we are here, the human papilloma virus, commonly called the HPV virus. So HPV, there are over 150 strains. Even some literature is even given about over 200 strains of HPV infection. They are grouped into high risk and low risk. About 99.7% of all cervical cancer cases are caused by the HPV infection, high-risk HPV infection, namely the 16 and the 18. So the high-risk ones include HPV 16, HPV 18, and they are the ones that usually cause cervical cancer. The low-risk ones are the likes of the 6, 11, 42, and 44. These ones are usually not implicated in cervical cancer, but are implicated in genital warts. As we are going, we see the warts that we are talking about. These are cauliflower-like rash. The warts are like cauliflower. I don't know if you know cauliflower. That's how they look. Depending on how they are, they can be very beautiful, very big, very appreciable. Okay, but the infection with HPV is asymptomatic. It means that you can have HPV and you can have it for years and you might not show any symptoms. As I stated early on, the infections with HPV, it's not all infections with HPV that would result in cervical cancer. And it's not, let me say it this way. So infections with high-risk HPV 16 and 18 doesn't automatically mean somebody will have cervical cancer. It is the persistence of the infection, which means that naturally, if you get HPV, you're infected with HPV, your body's first response is to fight or clear that infection. But if your body is unable to do that, that's what leads to the persistence of the infection, which we call the persistent HPV infection. And this is what leads to cervical cancer. But in some people, we will see that they are at increased risk of having persistent HPV, okay, like immunosuppressed people, because their body is unable to fight infections. HPV is multicentric, which means that HPV affects every part of the body. We saw a case of HPV of the finger, which led to a cancer of the finger, HPV of the vulva, HPV of the penis, HPV of the scrotum, HPV, different places. Okay, so HPV can affect anywhere at all. So The next slide, you see how the wart-like rash I'm talking about is. So the picture on your left, that's how it starts. It starts like a flat one with the edges a bit raised. Then as you are going on, you see on the top right corner, you realize that they become elevated. And if you zoom closer, you realize that they are like cauliflower. And then it's not always disseminated. It's not scattered. It's not always scattered. Sometimes it is just limited to one particular place, or sometimes it's just scattered in the vagina or the vulva of the woman. So the gland one we see down there is the penile cancer from HPV. So you see that the gland's penis, the head of the penis, everything is gone away, and that is caused by HPV. So the next picture, we'll see that HPV of the anus. So you see the cauliflower-like rash, which I call the warts. You see it at the anus, and then that is warts, extensive warts of the vulva of a child. These are all images of children. So you wonder how these children got these HPV infections. Yes, I know the first thing that anybody would think about is assault or rape or defilement. But it's not always the case. Sometimes sharing things, as we're going on, we'll talk about it, sharing things as basic as bentoa, bulb syringes. It has been found that it can harbor HPV infection. And then, so you realize that when we're growing up, our parents will go to our neighbors or our aunties, or they themselves, the bulb syringes they will use on us. So these are ways by which HPV can also be transmitted. So the next slide, you see the HPV of the throat. So for people who have oral sex, we call that penis oral blowjob, and then vaginal oral, we call that cunnilingus. So any of these can predispose you to having throat cancer, and that's how throat cancers look like. So as I was saying earlier, so HPV can be transmitted sexually and asexually. So the sexual means involve the penile anal sex. So the penis into the anus. That is the penile anal. Then the genital. So either vulva, clitoris, penis, anyhow that works. Genital. Then we have the oral genital, so which is the cunnilingus, and then the blowjobs I talk about. And we have the manual genital, which could either be with fingers, sex toys, fisting, and the like. So they are introducing the whole fist into the genital area, or they're introducing their fingers into the genital area, or sex toys, or cucumber. These days, we've heard a lot of cucumber. So all these things that we introduce there, these things can, if they are harboring HPV infections, can transmit HPV into the vagina or the anus. Then we have the manual anal, which we also see with sex toys, and then cucumbers and the fingers and the legs. So the non-sexual means is through the vertical transmission. I mentioned earlier that STDs can be transmitted vertically, which is from mother to child. So during childbirth, a mother can transmit an STI. In this case, HPV can be transmitted from a mother to the child. And then we also have the non-vertical means, which usually the non-vertical means, it's rare, but it can happen. Example, using of the bulb syringes that I spoke about. Yes. So these are all non-vertical means. And then, so sometimes people even say that if like you sharing of washrooms with people who have maybe genital warts which are breaking off, and then you can find them in the toilet bowl or stuff like that. So if these warts are transmitted from the toilet seat into your vagina, and then there's a break, you can also have cervical HPV, either cervical HPV, vaginal HPV, vulva HPV, or the likes. But again, as I stated, it's usually less the inoculum, which means that the amount of inoculum you need to cause the infection is not enough in this non-vertical means to cause an infection. So rarely do they cause infection. That is not to say that they do not cause infection. So what are some signs and symptoms of when you have HPV infection or cervical cancer? HPV, as I stated earlier, on its own, it can be there for many years, no signs, no symptoms, nothing at all. However, when it has developed into cervical cancer, which we are not happy about and we don't want to happen, women will experience abnormal vaginal bleeding. This bleeding can either be unprovoked, postcoital, which means that they're having sex and they are bleeding, and then intermenstrual, she has finished bleeding, and then just a few days later, she's bleeding. It's not time for her to menstruate, but again, she's bleeding. This is also not to say that if I'm having intermenstrual bleeding or postcoital bleeding or unprovoked or postmenopausal bleeding, it means you have cervical cancer. No, that's not what it means. But we've seen these things happen in cases of cervical cancer. And so yes, when you come, your practitioner, when you go to the hospital, your practitioner may ask you to do a PAP or whatever it is. All right. So, and other symptoms include abnormal vaginal discharges, which can be very offensive. So in cervical cancer, some of the symptoms that they might come with is a very offensive vaginal discharge. And they would tell you that it's a lot. It's a lot and it's very, very offensive. The discharge from cervical cancer is really offensive. And then maybe unexplained weight loss. All right. So how do we prevent this? All right. There's a lot of awareness creation about cervical cancer, because cervical cancer is preventable. It's a preventable death. Gone with the days, as I don't know if I said it earlier, but cervical cancer is the number 2 cause of cancer deaths in women in Ghana. It is an avoidable death with early detection. So when you detect it early, there are treatments that can be started, and it doesn't even develop all the way to cancer. So when the precancerous lesions, it can be treated in the hospitals with either ablation or whatever, depending on the stage it is, and then it is treated and you are fine. You are fine. You can have all the sex that you want. Nothing changes. But when it is advanced, that is when sadly we cannot do anything about it. That is why we are preaching the screening. So the prevention mainly is by primary prevention. Primary prevention, which involves the education that we are doing and awareness creation that we are doing now, and then vaccination, encouraging people to vaccinate. And the secondary prevention is treatment and screening. So the vaccination for HPV, there's vaccine. So for all these STIs, vaccines exist for HPV and then hepatitis B. HPV vaccine is expensive. So that is one of the pitfalls we are having with cervical cancer, because it's not everybody who can afford it. Currently, the vaccine is going for about 1,800 per one shot, and you need a minimum of 3 shots, depending on the one that you want, if it's the Gardasil. But the other ones are also around the same price. So you can just imagine why people are not going for the vaccines readily. And then HPV, hepatitis B, for the hepatitis B vaccine, it is readily available everywhere you go, and it's not as expensive. Currently, it's about 40 cedis or 50 cedis per shot, and then you need a minimum of about 4 shots. So now to safe sex. So how do we have safe sex? What is safe sex at all? So there are practices that reduces an individual's chances of having sexually transmitted infections. So it is not just limited to just practices alone, but again, these practices are avoiding exchange of bodily fluids. So safe sex practices, it eliminates exchange of body fluids in the individual. Why are we talking about safe sex? This is because we want to reduce STIs and STDs in people. What are the things that can reduce, or what are the activities, or what are the practices that when you incorporate, it reduces your your chances of having STDs, use of condoms, and dental dams during intercourse. So these dental dams are, as we go on, we have a picture as we go on, you will see it. These dental dams, they are used for oral sex. Okay, they are just condoms sort of that are used to cover the especially for the women, the vulvar area, and then you can have your oral sex. This reduces your chances of having the STIs. And then the condoms too, we are talking about good use of the condoms. You're not talking about right use of the condoms. So you're expelling the air and then you're rolling it up and then you're disposing it off right. And again, how can we also practice safe sex? Practicing monogamy. Again, abstinence is number one on top of all this list, abstinence. But for sexually active people, you cannot preach abstinence or you cannot tell them to stop having sex. So we only tell you to use condoms, one, and practice monogamy. Practice monogamy, which means one partner at a particular time, not having multiple sexual partners at a particular time. It will reduce your chances of having STIs. And again, we encourage people and their partners to be aware of their bodies. Like I said, if you are aware of your body, like a woman, you are aware of your body. When you have an abnormal discharge, you would know, because you know the discharge that are normal with you. Or even when you see an abnormal thing like a rash, and which was not initially there, you know that no, this wasn't initially here and now it is here. And so you are self-aware and therefore you can seek care as soon as possible. Again, partners, we encourage partners again to be very aware of their sexual partners. So your wives, your husbands, be their keepers. Know their bodies very well, so that when you see something abnormal, like a foul smelling odor, which was not always there, or a rash which was not always there, you can be able to tell them and then draw their attention to it. And use of lubricants. So for women who experience a lot of dryness and menopausal women, we encourage use of lubricants. These lubricants will prevent micro tears or sores when you're having sex. Okay. We also encourage people to avoid sharing sex toys. Sharing sex toys, the infections can harbor around the sex toys, and then you can transmit it from one person to another. Again, we want to avoid alcohol and the use of drugs before sexual intercourse, because the excitement and the whole mood with the drugs and alcohol in our system makes us engage in very risky sexual behaviors. We want to roll on the floor, we want to roll our head, we want to do all the things that will predispose us to having sexual transmitted infections. We also have to be very aware of the symptoms that I have discussed, so that when you see it early, you can report to the health facility. So like postmenopausal women, it's encouraged that you use a lot of lubrication to prevent the tears. Again, women with dryness, who experience dryness, and this postmenopausal women, we encourage you to talk or communicate your preferences, your sexual preferences. If there is this particular style that makes you dry quickly or that makes you feel uncomfortable, please speak up, speak to your partners about it, and then it can limit the chances of having STDs, because the more you are having the cuts or you're drying out or you're doing this uncomfortable styles, you can get micro cuts. We can predispose you to getting STIs if your partner has it or not, or you yourself, you have multiple partners and then they have it. All right, so this is how the condoms look like. This is how on our right side, extreme right, is how the female condom looks like. It has a rim inside. You hold the rim and push it inside the vulva, and then you open the ends, which is the opening side, on the vulva. It's a bit cumbersome, unlike the male condom. So on our left side also is the dental dam that I spoke about. These are the ones that are used for in cunnilingus for oral sex. If you do not have, it's not readily in the market, but if you want to have one, or you are in the mood and you want to have oral sex, but you want to protect yourself, you can get a male condom and then cut the ends of it, the two ends, just like the next slide. You cut the ends of it, then you cut the middle to open it, to part it open. So the next slide would show what I'm talking about. So the head or the tip of the male condom is cut, and then the tip is also cut off, and then you make a longitudinal slit from the end to one end to the other. Then you open the condom this way, and now you can put it on the vulva and then have your oral sex if that's what you. Okay, so how do we prevent this? So as I stated earlier about it, hepatitis B, you vaccinate. Vaccination. So you vaccinate, you need a minimum of 3 shots over a 6-month period and yearly boosters. For HPV, it's given from the ages, at the moment, it is not part of our immunization schedule, but it is recommended that for the vaccine, it should be given preferably and ideally between the age 9 and 15, mainly because at this age, it is thought of that they shouldn't be having sex. And so before they start having sex, they are protected against it, which is not always the case. We know that people are having sex even earlier than this. But in the ideal state or in the ideal situation, the vaccine is usually given between 9 and 15 years. So for your children and for parents who can afford it, we encourage you to get the vaccine and give your children within the ages of 9 and 15. For women older too, they can take the vaccine for women who are older. But again, there is also literature which is saying that women above 40 years, there's really no point of having the vaccine. But again, better safe than sorry, right? So if you can afford it, first you'd have to do the HPV screening and make sure that when the screening comes out and you're negative, you don't have HPV. That is when you can take the vaccine. The HPV vaccines available do not protect against all types of HPV or the 150 strains of HPV I spoke about. The Cervarix only for the vaccine Cervarix, which is in town, Cervarix only protects against high-risk HPV, which means it protects against the strain 16 and then the 18. The Gardasil 4, it protects against the high risk, 2 high risk, and 2 low risk, which is HPV 16, HPV 18, HPV 11, and HPV 6, which are the low strains. So these protect against 4. Then there's now Gardasil 9. Gardasil 9 protects against the 2 main high risk and then others. So that's what happens with that. And so for people who have had sex with partners and they fear or their partners are retropositive, we encourage you to have the PrEPs, which is the pre-exposure prophylaxis. We encourage them to take that. Again, other treatments are the antimicrobial. So you go to the hospital, whatever infection you have, then they treat you with any of that antimicrobial, depending on what's the exact infection you are coming with. So in conclusion, what are we taking home? STDs are preventable. Women, we are also encouraging women to speak up about sex. If the position is uncomfortable for you, whatever it is that you have to communicate about sex, please communicate it with your partners. Feel free to tell them the comfortable positions or the ones that prevent you from having tears. Initiate them if you can, okay? Those are ways that you can practice safe sex. And then if exposed, please visit the nearest hospital as soon as possible. When you think that you have been exposed or you have symptoms, please report as soon as possible so that we can detect it early and treat you early. We are also encouraging all women who have not had PAPs before, or who have not had the cervical cancer screening at all done, to in this month and subsequent months to have their screening done. At least the PAP will do, so that you know your status. Thank you so much, and I'll take the questions now.
Thank you, Mary, for that insightful presentation. It's time for some questions from the audience. You can drop your questions in the chat box, or you can raise your hand and I'll go ahead and call you. We'll give questions about some 10 minutes. Any questions, please? Okay, so I'll start with my question, Mary. Where can you give us some locations for getting the vaccines presently in Ghana?
Okay, so the vaccines so I can give you places like Akawe, Ridge Hospital, Kolebu, and then 37. Those are places you can readily get it if vaccines the vaccines are quite scarce. But when they are available, these places I'm mentioning, I mean, Adabraka, not Akawe, Adabraka Polyclinic, these places are places that you can get it. Zimmerman Presbyterian Medical Center can also has some that is readily available for people who wants to be vaccinated. You just have to let us know, and then we'll get it for you. Thank you.
Oh, thank you.
So depending on the one that is most closest to you, then you'll get the vaccine over there. So the facility that is closest to you. But the Ridge Hospital, 37, Adabraka, Kolebu, these places are certain of getting vaccines.
Thank you.
So just whilst you are thinking of your answer, your questions, I want to add a little bit. So with the vaccines, we can procure for you. We are the only CHAC facility that can get you the vaccines. We can screen you. We can do the treatment. So please, if you, after the meeting, you want to do some few checks, let us know. If you have a spouse, you're having or a partner you are suspecting, yes, bring them to Zimmerman. Will screen them for you. Thank you.
There's a question that asks whether you accept health insurance.
Yes, we accept.
So for the treatment,
so we receive health insurance here, but it's not covered on insurance. The vaccine is not covered by insurance. The screening is also not covered by insurance. So you pay for these services.
But is the treatment, if you do have it, is the treatment covered by health insurance?
It is not covered by health insurance anywhere.
No,
so when you test positive or you have any lesions that need to be treated, it's not covered by insurance. But depending on the procedure that you have to undergo and how much you would pay for. Okay.
And there's another question about the warts. Are the warts curable? What's the treatment for that?
Okay, so yes, the warts are curable depending on how extensive they are and what medical intervention would be used. So depending if they are smaller ones, they might give you a cream or point of care treatment. So when you come, they can just apply whatever treatment that you need on it for you there and there, and then you're fine. But if it's very extensive warts, like the ones I showed, which has occupied all over the vulva and then even in the vagina. In those cases, you need very surgical treatments to be able to take away all that warts, because the topical treatments would not work. Thank you.
Thank you. I remember you said the cost of the vaccine is 1,008, but what's the cost of screening?
Okay, so the cost of screening, it depends on the facility you are having it done in. So some places, the PAP, so the screening, we have the PAP, we have the visual inspection with acetic acid, we have the HPV screening, the HPV, yes, the HPV screening. So the HPV screening, you are trying to identify the presence of the HPV infection, which usually costs between 250 and 500 cedis, depending on where you are doing it. For the visual inspection with acetic acid, the healthcare worker is looking at the cervix with their eyes or with an eval, and then they are looking at the cervix to see if there are any changes or like any cancer changes, pre-cancer changes on the cervix, so that then you can treat the precancerous so that it doesn't lead to cancer. And then we have the PAPs. The PAPs are done to take those cervical swabs, and they also range between 250 cedis and 300 cedis, depending on where you are doing it for. So I can't speak to a particular place because I don't know where everybody stays and where they are doing it, but it is both individually. The VIA usually the most you can spend on VIA is 50 cedis, but in some places, yes, you can go beyond that. But PAPs, you can budget between 250 cedis to 300 cedis. Is the HPV DNA testing, which is testing for the presence of the HPV. That is what is expensive in most places. That one also ranges between 250 cedis and 500 cedis, depending on where you are doing. And these prices can even be more than what I am saying, depending on where you are having the screening done.
And there's a question that asks, how often do you have to do the pap smear?
Okay, so it depends on your first pap results. So, and then your medical condition. So if you are HIV positive, your screening is yearly. If if you are HIV positive and you tested positive for either the lesions or the HPV, your screening is yearly. If you are HIV positive, but you tested negative for HPV, your screening is every 2 years. But for a normal individual who doesn't, okay, quote and unquote, if you go and then you go and have a screening done, let's say I go and have a screening done right now, and I am negative for HIV positive, or negative for HPV, I will screen again 3 years time, like in 3 years. So until I have had persistently 3 negative PAPs or HPV testing, that is when I would stop screening. Should I come again or it's okay?
Please come again.
Okay. So if you are HIV, I stated that some people are quote unquote maybe sensitive clients, or they are at most at high risk of having the cervical cancer. So like the HIV patients, because of their immunosuppression. So in those people, we tend to screen them very frequently. So if you go and screen today, let's say you go and have an HPV test today, and then the HPV is negative, and then your VIA, everything is fine. No, your PAP result is negative, your HPV is negative, VIA is fine. You repeat your test 2 years time. But if you are HIV positive, but you tested positive for either of them, your screening, let's say ideally not PAP, but HPV. If you tested positive for HPV, you repeat your HPV test in a year time. So in this case, in this person's case, HPV is positive, PAP is negative, VIA is negative. This person will screen again in a year. In a case where HIV is positive, PAP is negative, HPV is negative, VIA is negative, this person will screen 2 years. But if an individual who doesn't have HIV will have the first screening, PAP, HPV, VIA, and it is negative, all is negative, the person will rescreen in 3 years' time. So if the person does it every 3 years, 3 consecutive times, and then they are negative in all these 3 consecutive times, they stop screening. Is it clearer now?
Yes, please. So on the average,
Okay.
every 3 years.
Yes, every 3 years.
And can anyone with cervical cancer not bleed and are severe waist pain or lower backache symptoms as well?
Yes, all these things. So cervical cancer is symptomatic, as I stated earlier. It's not everybody like malaria. It's not everybody who has malaria will come vomiting, but some people will come vomiting. It's the same in cervical cancer. Not everybody will come with unprovoked vaginal bleeding, but in very advanced stages of cervical cancer, they come with vaginal bleeding, unprovoked. He says that's okay.
Yes, please. Okay, so I think the questions there's a question. No, no worries. Thank you.
Okay.
Thank you.
All right. Thank you too.
Thank you very much, Mary, and we are grateful for your time. And I would like to ask someone to pray for us. Kuku, can you please give us the closing prayer? We didn't start with prayer, but you can end with prayer for us. All right, so Nee, please pray for us.
Hello. All right. So we are praying. Moderator, please, I think Johnny asked a question. I don't know if it's an oversight or that is very great. I think there's a gentleman asking of something a doctor once said. So if you can ask the facilitator to assist us on that, that's if it's possible. So we can proceed with the prayers. Thank you.
There's a question that states that a doctor once said that there's more money in the pelvic of a woman than the gold mines of Obuasi. Why so, Doc? I want to know the rationale behind the saying. Mary, please, do you have an answer for that?
I have never heard that before, and I don't know why he said it and in what context he said it. Please, if the person asking the question has an idea, or anybody in the house has an idea, should please enlighten us. I have no idea why they are saying that there's money in the pelvis of a woman. Hey, interesting.
Dr. Anna, please, have you heard this expression before?
Oh. Well, there are a lot of findings in the pelvis of a woman when it comes to gynecology. So, exploring that part of a human being will cost you a lot than just the pineal shaft. So, there are a lot of conditions over there. That's what basically it means, and there are a lot of things to be managed in a woman's pelvis as compared to a man's. So I think God made it special that way.
Women are special. Thank you very much, Doc. Nee, can you please pray for us?
All right. I think there's one more question. So it has to do with the cost of the test, if that can be handled then.
Okay. Okay, so Mary, someone is saying they didn't hear the amount for the test and the subsequent price for the vaccine. They didn't hear that clearly. Can you please come again?
Okay, so I was saying that the prices will vary depending on which facility you are having the test done. But every like the HPV DNA testing, the PAP, and then the VIA. The VIA, you can estimate about between 50 cedis and 100 cedis for a VIA to be done. A PAP will cost you between 200 cedis or 250 cedis to 400 cedis. And HPV DNA testing, that's the one which is telling you that you have this type of HPV present in your vagina, vulva, or cervix. That can range between 300 cedis and 500 cedis, depending on where you are doing it. And these prices can vary. It can even exceed what I am saying. So depending on which facility you are getting your screening done, and then where you do it. The vaccine, at the moment, I can't say, but the last time I asked, which was somewhere in December last year, the one shot of Gardasil 4 was going for around 1,800. And usually the prices are changing every time, which is just for one shot. So I can't speak to the very current price. Maybe I'll just ask later and then let you have the actual price, the actual current price. Yeah, thank you.
Thank you.
Right. So reach out to us. We can get the vaccines for you. We can do the testing for you at relatively cheaper prices. And we also engage in group testing, screening, and management. So we're available.
All right. So anyone interested can reach out to the women banking team, and then we'll put down your details and share with the team. Thanks.
Right. Okay, so we are praying. Lord Almighty, we thank you for a successful session. And we pray that whatever we've been taught on this webinar today, we put it to use. And then, yes, thank you. Have a good evening.
Thank you. Thank you.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support.
I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman.
I am a W woman.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support.
I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman.
I am a W woman.
I am a woman.
I am a woman.
I am a woman.
I am a woman.
I want to be successful.
I want financial support.
I want affordable health service.
I want to be powerful.
Powerful. Supported.
Inspired. Connected.
Educated.
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 I want specialized banking.
I want maternal care.
I want to be empowered.
I am a woman. I am a king woman.
I am a king woman.
I am a king woman.
I am a W woman.